Another movie, another stunt. I'll eat better when life finally slows down. Cut! Is Jim okay?
Before we decide what's happening, what life-threatening conditions can cause sudden chest pain? Jim, can you describe the pain for me? Is it pressure, tightness, burning, or something sharp?
It feels like a heavy weight crushing my chest. It's spreading to my left shoulder and arm.
Luna, why does that happen?
I'm not sure. Do you know the mechanism?
The heart and left arm share the same spinal cord pathways. The brain can't tell the difference, so heart pain is felt in the left arm. This is called referred pain.
Now I understand.
Luna, what abnormality do you see?
ST segment elevation.
Correct. Correct. Luna, does ST elevation always mean STEMI?
No. These conditions can all cause ST elevation.
Luna, what blood test helps confirm heart muscle injury?
Cardiac troponin.
When heart muscle cells are injured, troponin leaks into the bloodstream. Luna, does an elevated troponin always mean a heart attack?
No, there is heart muscle injury.
Can you think of conditions that can raise troponin besides a heart attack? Luna, how do we diagnose an acute myocardial infarction?
Typical symptoms, ECG changes, and elevated cardiac troponin.
Always put the whole clinical picture together. Luna, what's the first thing we should do?
Activate the STEMI team.
We've diagnosed Jim's heart attack, but do you know what caused it?
Dr. Heeman, what's that tiny yellow spot?
It looks harmless today, but never underestimate it.
It kept growing all those years, and Jim never noticed?
This is called an atherosclerotic plaque. It grows silently for decades before causing symptoms.
The plaque burst open!
Now the bloodstream sees it as an injury.
They're rushing here so quickly.
The exposed plaque tells the platelets that a blood vessel has been injured. One platelet activates many others, and the clot grows rapidly.
The entire coronary blocked.
Platelets on the exposed plaque. It has completely sealed the coronary artery, stopping blood flow.
Without rapid restoration of blood flow,
Without cardiac progresses to myocardial infarction. Once heart muscle cells die, they cannot regenerate. The heart is calling for help.
without oxygen, injured heart muscle pain signals.
That's why Jim feels crushing chest pain. Think like a doctor. The main culprit here is platelet aggregation. What medication would you use to stop the platelets from sticking together?
Aspirin!
Excellent. Let's see how aspirin works. Activated platelets are releasing thromboxane A2 to recruit more platelets. Aspirin irreversibly blocks COX-1, so the platelet can no longer produce thromboxane A2.
The clot stopped growing. Exactly.
Aspirin blocks thromboxane A2, preventing additional platelet aggregation.
The platelets aren't calling for reinforcements anymore.
Exactly. Aspirin stops aggregation. What should we give next? Aspirin blocks thromboxane A2, but ADP can still activate platelets through the P2Y12 receptor. What medication should we give next?
A P2Y12 inhibitor, ticagrelor or clopidogrel.
When ADP binds to the P2Y12 receptor, it tells the platelet to become sticky and recruit more platelets. Ticagrelor blocks the P2Y12 receptor, so GPI3A receptors are not activated and platelets cannot stick together effectively. We've stopped platelet aggregation, but the fibrin clot can still become larger.
What medication should we give Heparin? Heparin!
Heparin doesn't dissolve the clot, it activates antithrombin. Activated antithrombin inactivates thrombin and factor XA, preventing new fibrin from forming. Heparin prevents the clot from growing, but it does not dissolve the existing clot. To restore blood flow, this patient needs emergency PCI. The balloon pushes the blockage against the artery wall, reopening a pathway for blood to flow.
The artery is open again, but we still need a stent to keep it open.
The artery is open, but the metal stent can still attract platelets. What medications help prevent a new clot from forming? Dual antiplatelet to flow freely while preventing platelets from aggregating on the stent. Luna, what long-term medications protect Jim?
Dual antiplatelet therapy prevents stent thrombosis. Statins stabilize plaque. Beta blockers reduce the heart's workload.
Luna, how do ACE inhibitors protect the heart after a heart attack?
ACE inhibitors reduce angioedema, preventing harmful ventricular remodeling and helping preserve heart function. Dad, I thought hamburgers were your favorite.
Salad is my new favorite.
A stent opened Jim's artery. Healthy choices protect his future.